Where do you want, oh, is that mine?
No, that's mine.
Oh, that's mine. Oh, that's interesting. We have the same phone.
Phone twinsies.
Am I live?
Yes.
Okay. Sorry for the goofy discussion. Welcome to another masterclass at the Country Clinic. I'm Randy, and I'm going to talk a little bit today about blood pressure challenges. And before I do, I want to start with a disclaimer. And my disclaimer is that sometimes we talk about health challenges and we give recommendations, and we make the assumption that these recommendations should apply to every single person that's participating, and that's not the case, right? The best recommendations always have to be personalized. They have to be implemented based on your age and your date and your challenges and your health conditions and the medicines and so forth. So I'm going to talk about fuzzy generalities today, and then asking you to make sure that you take my discussion as a form of education, but not as a direct recommendation that this is what you should do, okay? And my point to that is I'm going to start with salt, because we're going to talk about blood pressure, and one of the questions that came up today is, so we should all be on a low salt diet, right? And my response is, maybe. And so here's why. Can salt raise blood pressure? The answer is yes, it can raise blood pressure. So does that mean that every single person needs to be on a low salt, no salt diet? And that's not how I live, right? I don't eat everything low salt, no salt. I like a little salt. In fact, I think my favorite salt on the earth is garlic salt. I love garlic salt. And so if you come eat at my house, we have garlic salt on just about everything because we love that. So I would sound very hypocritical if I said to you, we shouldn't be eating salt, and yet I'm salting most of my dinners at home. So I'll talk a little bit about that as we go on. So first of all, I want to teach you what makes blood pressure go up and down. And can I erase this?
Yeah, just leave the right side.
Okay. Don't touch the right side. So I'll just erase the lunch and learn, and I'll keep the hypertension. I'm going to draw a pipe or a blood vessel, okay? So if this is a blood vessel right here, this is where blood flows through that vessel. So if I was to draw this, let's say that you got little cells floating around, and this is how we pump red blood cells to all of our tissue. This vessel is a very sophisticated organ, okay? And a blood vessel actually looks like this. Okay? That pipe has a very nice external coating around it. Who knows what that external coating around that pipe or that vessel is made out of? Not quite lipids. It's made of muscle. What? You know that all of your blood vessels, your arteries specifically arteries I'm talking about, have a muscle layer wrapped around it. And it makes intuitive sense because you know this, because arteries have to be able to contract and they have to be able to dilate. And when they contract, what happens to pressure? It goes up. And when they dilate, blood pressure goes down. So just think of, in the summertime, we're all outside sliding on the ground. We put plastic down and we run through the sprinklers and we slide through that and so forth. And if you take your garden hose and you kink the hose, what happens to the pressure?
It's hard.
This hose starts getting stiff and hard, and it's getting ready to go. And as soon as you relieve that pressure, it just sprays like crazy. Well, your blood vessels have to do the same thing. The way we raise our blood pressure is that muscle contracts, and this gets smaller diameter. And when we want our blood pressure to go down, this muscle dilates like that. About 10 years ago, this muscle layer right here was reclassified in medicine as an endocrine gland. What? think I've lost my mind, right? There's a lot of talk that this muscle tissue is an endocrine gland. Well, what does that mean? What are other endocrine glands in the body? Your thyroid's an endocrine gland. It releases a hormone. The ovaries are endocrine glands. They release estrogen and progesterone. And the testes are endocrine glands, right? The adrenal gland is an endocrine gland. An endocrine gland releases a hormone. So this isn't just straight muscle tissue like your bicep. This is muscle tissue that releases a hormone. What's the hormone? Anyone know? It's called nitric oxide. NO is how it's classified in medicine. So nitric oxide is the hormone that is released from the endocrine muscles that wrap around your blood vessels. What do you think that this hormone does? It dilates, or it relaxes that muscle tissue. Okay? Now, fun thought, maybe not a fun thought, Viagra stimulates the production of nitric oxide. And so it dilates blood vessel and then drives blood flow to certain parts of the body. Okay? So that's a pretty fascinating thing of what this endocrine gland does. So now you understand why our blood pressure gets really constricted or we get relaxed. So high blood pressure is a problem. And it can be a problem long term because if I go back to your garden where you're running through the sprinklers and sliding on the plastic that's wet, what if I took that garden hose and I pressure washed all of my flowers?
You're gonna kill him.
I would kill them. I'd ruin all the flowers. Why would I?
Too much pressure.
Too much pressure. You can't handle that much pressure. So think of your eyes. Teeny tiny little blood vessels through your eyes. If we have wicked pressure running through your eyes, it causes ocular problems. We have our kidneys, our thin, sensitive tissue. It's like a filter. The blood flows through this little filter nice and easy, and it filters out the toxins, and then that goes into our urine and we pee it off, right? So what if that filter is like tissue paper and we pressure wash it because our blood pressure is through the roof? What happens to kidney function? It goes south, right? We go into kidney failure. We have kidney failure problems, or we call it chronic kidney disease. Your heart is a muscle. And if that muscle has to pump against a really hard pressure all the time, pressure's elevated because all these blood vessels are clamped down, so pressure's high, and the heart is beating and beating and beating really hard, the muscle gets bigger and bigger and bigger because the heart has to be strong enough to pump against that pressure. And in medicine, we call that dilated cardiomyopathy. Right? The heart just gets big and floppy because it has to work so hard to pump against this pressure. So high blood pressure does create long-term problems. It creates issues. It creates issues with sensitive tissue. It creates heart issues. It leads to stroke. It leads to all kinds of things. So we want our blood pressure in the sweet spot. Okay? So more and more, as I watch the guidelines for blood pressure, I'm going to erase this section here real quick. When I first started practicing medicine in the early 2000s, a blood pressure of 140 over 90 was considered a high blood pressure, right? And oftentimes I would not treat that. I would say, well, let's not treat that. Just keep an eye on it, and I might initiate treatment if someone was 150 over 95 or 160 over 100, then I might initiate treatment. As I've watched the recommendations is to keep bringing that down. So now we say 135 over 85 is that pre-hypertensive stage, and we want people less than 130 over 80. And I'm going to draw the less than sign. This is where we really want people. If we could keep you in the 120s over the 70s, it's perfect. And it's perfect because It protects your kidneys against that high blood pressure. It protects your eyeballs. It protects your brain against that really high pressure that's going on. Protects your heart against being dilated and going into congestive heart failure. So our long-term goal, I'm going to keep erasing here. I'm just going to say our goal is 120 over 70. Okay? And some of you listening might think, oh my gosh, my blood pressure has never been that low. The worst time to do blood pressure is when you're stressed out, when you're wound tight, you go to work. Guess what? My blood pressure is probably elevated because I'm talking to all of you, right? So the way you want to check your blood pressure is you want to sit down in a chair, put both feet flat on the ground, not cross your legs, and take some slow, deep breaths and settle down for a minute or two. Let's see what your blood pressure is when you've actually relaxed. People come to my office, and when they come, they got to fill out all their paperwork, they got to give their insurance information, then they got to pay for their visit or make their copay or do whatever. By this time, they're wound tight, and their blood pressure is high. That's the worst time to check a blood pressure. Oftentimes, when people come to see me and a medical assistant takes their blood pressure and I see what the pressure is, I think, okay, let's just sit down and talk and let's have a discussion and we'll check it at the very end and see if that has come down. But this is the goal, 120s over 70s. So Nikki created this really beautiful handout about what you can do to lower your blood pressure. Let's just start by talking about stress. If you're wound tight, your pressure is probably going to be elevated. So what are the greatest ways to unwind? I'll tell you what my favorite is. Exercise. Right? And isn't it funny, Caitlin, that every discussion I give, it always starts with the best intervention is exercise, right? It's just kind of how I was built, I think. I wake up in the morning and I just think I've got to get some movement in. In the middle of the day, I think I got to get some movement in. In the evening, I'm constantly thinking that. And I wear an Oura ring that tracks my steps, and it gives me a good indication of how many steps that I've had. And I will range in a day, usually between 12 and 15,000 steps in a day. And that's even on a day I'm sitting on my butt all day long seeing patients. Because I usually start my morning with a long walk, and I'll get 8,000 to 10,000 steps before I even sit down and have breakfast and take a shower. And then after work, I usually go get some more steps, either coach soccer or go to kids' basketball games. And if you ever come to one of my kids' games, I watch the game, and at halftime, guess what? I disappear. I go walk up and down the stands, I go walk around the stadium, I'll do something. Soccer was the best, because I just go walk around the track during halftime. Right? So that's how I get my steps in. That's so important. If you're listening and you're thinking, I don't exercise very often, then you have a problem. You need to be thoughtful about getting more physically active on a regular basis. It will change your blood pressure. It will change your stress. It'll change a million things in your life. Okay? Now let's go back and talk about salt. Who needs to be really careful with salt intake? Well, if your blood pressure is 160 over 100, you should probably be more careful with salt intake. If your blood pressure is low all the time, you're 100 over 60, you're one that doesn't need to sweat buckets about salt. Knock yourself out. If you eat a highly processed diet, top ramen, mac and cheese, processed meats, right? All the processed meats, this is how we preserve them, as we load them with sodium nitrates and phosphates and lots of salt, because it's a preservative. So the more processed foods you're eating, the more salt you're getting. That means you should probably be careful about adding more salt to your diet. If you're cooking from scratch and eating whole foods, well, guess what? I just had a large dinner salad. There's not that much salt in a salad, right? So that's something that you can be thoughtful about. And so I started by saying, be careful of gross generalizations. I'm just talking generally. Some of you probably should be more careful with salt. Others don't need to worry about it all that much. Okay? There's a statement that other medical conditions can raise blood pressure. Do you know what one of the big conditions that cause an increase in blood pressure is? A concussion. or a traumatic brain injury. Because when you damage the nerves in your brain through some sort of concussion or an injury, it stimulates your nervous system to be a little bit more in fight or flight. Lots of anxiety, you're kind of wound tight, a little bit more likely to be dizzy, and that stimulation around the blood vessel right here will constrict those vessels, and people tend to have a little bit higher blood pressure after they've had a head injury. Any other questions or conditions about what drives that and what we can do to improve it? I'll just give, I talked about anxiety and I talked about exercise. Just doing some deep breathing exercises can make a whopping difference. Just trying to find a way to decompress and relax and de-stress. Last night I'll have to tell you just kind of a dumb story. Sometimes I work from home, and when I'm working from home, if I'm not careful, I'll work from 7 in the morning until 9 o'clock at night, just because the kids are off busy, it's just me and my wife. And I made a conscious effort to stop at 7 o'clock, right? Work late. If you own a business, you understand what that means, right? And my wife and I sat down, and she made this beautiful dinner. We had dinner together, and I said, let's see what sporting events are on TV, because we love watching sports. And the women's national soccer team played Brazil last night. And so we sat and watched the game and talked about it. It was so relaxing. It was a great way to decompress. It wasn't stressful at all. And I thought, I need to be better at decompressing at night and relaxing and turning it off before I go to bed. Some people like to relax by checking social media. Is that a really relaxing thing?
No.
Yeah, in most
Especially right
cases
now.
it's not. It can be a little bit stressful. There's a lot of advertisements, so you're filling your mind with things that other people want you to think about. Sometimes we think about spending more money because of all those advertisements. Sometimes we see a post about politics that ticks us off and we're angry, and then we just mentally get into this rut. Other times we see friends or families or neighbors who post strong opinions, and then it just lights us on fire, and we think, oh, why are they doing that? So be very, very thoughtful. If your downtime is filled with scrolling through social media, it may not be as relaxing as what you originally thought it could be. Okay? And then I want to wrap up and just share a thought with you about nutraceuticals. What are some nutraceuticals that can really help to lower blood pressure? And we have a very nice supplement here at the clinic. It's the Country Clinic, and you can call and inquire about this particular supplement to help lower blood pressure. And we use some nutraceuticals in that make a huge difference. And here's just a handful of them. It's not all of them. First of all is we want to keep your omegas elevated. Omega-3 really comes from fish. Now sometimes we hear, well, if you have flaxseed oil, or you have primrose oil, or you have these different oils, you can get omega-3s. And the reality is there's very little omega-3 in those. There's some precursors, and part of the thought is if we take those precursors into our body will make enough omega-3. I don't share that same opinion. I think you very intentionally have to raise your omega-3s. And so, unless you eat a lot of fish, for those who know me very well, a lot of times at lunchtime I eat a can of sardines, and everyone hates me for it, because they're like, oh, it stinks in here, I can't believe you open that stupid can and go outside. Steph, has that ever happened here at the clinic? A million times, right? They just don't love it. If you eat a lot of fish, like sardines, you probably get a fair amount of omega. If you don't eat a lot of fish, you need to make sure that you're on a good omega supplement, because they're very anti-inflammatory, and they can make a little bit of a difference in this, right? It's probably a little bit more nuanced than that, but having a high amount of omega-3 is a big deal. In our supplement, some of the nutraceuticals that help to lower blood pressure, one would be called hawthorn berry. There's another one called feverfew, and there's just a whole bunch. Ginkgo biloba can make a difference at dilating a blood vessel. There's a lot of things that go into that. L-lipoic acid is another one that makes a difference. Many years ago, I bet it's been probably 10 or 15 years, I took care of a beautiful little senior that had some congestive heart problems, and she went and saw the doctor. The cardiologist recommends she start taking a beta blocker, and she said, I don't feel good with the beta blocker. Randy, is there anything else that I can do? And I said, well, I'm kind of stuck in this medical mode. Anyone with congestive heart failure needs a beta blocker. They need an ACE inhibitor, and they probably need a diuretic. So I was stuck in that mode, and I put pressure on her, and I said, hey, I really think you need these. She's like, well, I don't feel good with those. And I'm like, well, let's lower the doses. And when she came back a little while later, and I checked on her, her blood pressure was great. I said, oh, did you find the dose of those medicines that weren't good? And she said, no, I quit taking them all together because I told you I didn't feel good and you didn't listen to me. And I was like, oh, okay, well, I'm so sorry. How, your blood pressure's better? She says, yes. I started taking hawthorn berry, and I take it in big doses. And I asked her, well, what doses do you take it in? And she told me. And I said, well, how often do you take that supplement? She says 4 times a day. And I started wondering, gosh, we ask people to take blood pressure medicine sometimes 2 and 3 times a day. The goal shouldn't be, are you on a pharmaceutical or the nutraceutical? What's the goal? It's lower the pressure. And she reached the goal. She reached the goal using a nutraceutical product like what I've just talked about at the clinic. So my opinion is much less steeped in what you have to do. I think there's a lot of options. Some people need more lifestyle changes. Some people need a little bit more nutraceutical in their life. Some people might do all of those things and it's just not enough to manage blood pressure, and so maybe they need a pharmaceutical agent as well. And so I'm one that when people ask me what type of medicine I practice, I say I'm a mutt. Because I was trained in pharmaceutical medicine and I love natural medicine, and so I'm just a combination of both of those. And so that's my thought, that blood pressure, it really is important to maintain the sweet spot, and there's a lot of ways to do it with lifestyle, nutraceuticals, and pharmaceuticals. And I'll end with this thought. I want you to go to YouTube, and I want you to type in the aging brain. A-G-I-N-G, brain. And if you go to the aging brain, you will see a picture of an MRI of a brain, and the video's only 3 minutes long. That video shows a study that they did with seniors, where they did an MRI of their brain every week for 16 weeks. Now, have any of you ever had an MRI? Is it a real comfortable experience? No, it's claustrophobic. They put you on this table and they roll you into this great big tube, and it's super loud. Do you remember how loud it was? It knocks, knock, 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 like someone's pounding on a hammer, and you hear this engine running, and you're just laying there kind of, I don't want to scare anyone if you have to have an MRI, but it's not like going and getting a massage, okay? You feel like you're laying on a really uncomfortable cot in the middle of a construction zone where there's power tools everywhere. That's what an MRI feels like. They had these seniors do an MRI every single week for 16 weeks. And they identified that some of these individuals had as many as 5 mini strokes in a 16-week period. And you know the thing that sucks about that is none of the seniors knew they had a mini stroke. There was 0 symptoms. They didn't have a change in their cognitive function. It was just a little teeny tiny vessel that had been pressure washed. Now you know my analogy. Their blood pressure was elevated enough that that little teeny tiny blood vessel ruptured in the brain, and the patient was oblivious. They had no idea that that happened. Okay? That's scary, isn't it? Who wants to have 5 mini strokes in 16 weeks? What ends up happening over time is those people come to see me in their 60s and 70s, and they say, my memory's not as good as it used to be. I'm not recalling things. I'm not as organized. I can't stay focused. Then I ask them all these questions about symptoms, and they have no symptoms because they've been pressure washing their brain for the last 10 years on these teeny tiny little vessels. That 3-minute video called The Aging Brain shows you an example of this. So am I serious when I say you gotta manage blood pressure? You're darn right I'm serious. I'm always working to control that. It's one of the risk factors for neurodegenerative diseases like Alzheimer's disease, and it's a risk factor for all of the other things that we've talked about. Okay? With that being said, is there any questions or anything coming through social media?
No, but I have a question. So my husband used to suffer with high blood pressure. So they put him on like a medication. He hated it, so he didn't take it. But now he gets up and he gets really dizzy and has to sit down. So now I'm wondering if his blood pressure is low.
It's too low.
Is
yeah.
that a thing?
It is a thing, yeah. So I would answer you by reminding you of the story of the 3 bears. Goldilocks is hiking through the woods, finds the 3 bears' cabin and goes in and says, I want to sleep on this bed. Ah, that bed's too hard. So I'm going to try this bed. Ah, that bed's too soft. It's uncomfortable. But this bed is
Just right.
Mm-hmm. There is a Goldilocks approach to blood pressure. It has to be just right. If a person rides too high all the time, they have all of these risk factors with high blood pressure. Mm-hmm. If it's too low on a regular basis, they stand up from a sitting position and they get dizzy. Mm-hmm. Their energy level is poor. There's no gas in the tank. They chronically feel fatigued, and it's because you can't circulate blood if there's no pressure there. Right? So in your husband's case, I don't know what's driving that, but that's certainly something that's worth following up with and paying attention. The way we would check that, Nikki, is we would do what's called orthostatic blood pressure checks. And we would check his blood pressure in a seated position, and then we would have him stand up, and within 30 seconds to a minute, we'd check his blood pressure again and see what it is. And in that, we can see, is there a significant drop from when he goes to sitting to standing? And if there is, we call that orthostatic hypotension, and sometimes it's a form of dysautonomia. That's a whole nother topic. What do we do with dysautonomia?
Well, because I even remember when he came in that one time, his blood pressure was really high. But there's times where, he'll get up, he's like, whoa.
Yeah.
And so,
sometimes just the change makes someone feel a symptom. So his blood pressure might not be too low, but there's enough of a change from going from a sitting to a standing position that it elicits that symptom for 15 to 20 seconds. Okay. And so, yeah, we would just keep fine-tuning the process and figuring out how we can help that not happen. The greatest thing we can do in that case is exercise. Physical activity will strengthen that, right?
You'll see.
Here. Steph.
So for key takeaways today, would you summarize that the exercise and the relaxation and the difference in variation in those is what exercises those baroreceptors in and the nitric oxide and all those? It keeps the regulatory system of those. So that's why you want to do both, because it keeps that muscle in use. And
yes.
It's what keeps the osmolality in the
yes, when you do exercise, there are benefits to that exercise that then dilate a blood vessel and constrict certain blood vessels, and you do so much better. The term in medicine for that is called auto-regulation, where you don't have to manage that. You don't think about it. No one in this room thinks, I've got to clench down the arteries in my aorta to raise my blood pressure when I stand up. You can't control it voluntarily.
But by exercising and then by relaxing, you're allowing your body to self-regulate. And then compared to people who have sedentary lifestyles, where it's just...
Correct. It's a tone issue. So someone who uses their muscle all the time tones that muscle. It's got great tone to it. And someone who doesn't ever exercise the muscle gets flaccid. It loses its tone. The exact same thing happens in our blood vessels. Our arteries specifically have a tone to them. So the more that we exercise, the more we tone them. The second question that you asked was about relaxation. There is a cortisol and a stress response associated with blood pressure. It's fight or flight. Everyone knows what that is. You get fight or flight, your pupils constrict, and you're ready to get rolling, right? The bear's chasing you, and so everything constrict, the muscles are ready to go, you're ready to really dial this in. So what ends up happening with stress relaxation is if you calm down, you do some deep breathing, you're decreasing that fight or flight response, which will then have a hormonal response to lower your blood pressure. So yeah, all of those things combined can make a difference. And when Steph asked the question about relaxation, I want to ask you, don't answer this out loud, but just answer it kind of in your mind. Do you have a really defined plan to cause you to relax? And if your answer is, well, I just stopped working, that's not adequate. That's like me saying, is it relaxing to scroll on social media? That's called distraction. That's not relaxation. You're just distracting whatever you're thinking about in the moment to think of something else. It's just going to make you as irritated and PO'd, right? Because you get wound tight. And so please don't confuse distraction as a form of relaxation. It's not. One thing that I try to do, this is something that's personal, is I will try to sit crisscross applesauce on the floor and straighten my back and do some real deep breathing exercises and some stretching. So I'll lean forward and lean from side to side. It's kind of like a little bit of yoga. If you know my little girl Daisy, we showed Daisy the video called Goat Yoga. You guys have seen that? It's so goofy. And sometimes when I'm down on the floor sitting crisscross applesauce, I'll turn and get on all fours and I'll do a cat call. Right? You've seen that, downward dog, and I'll stretch out my back and I'll do it. And Daisy would always come running in, Goat Yoga! And then she'd jump on my back and body slam me. And I'd be like, Daisy, I'm trying to relax. She's so goofy. But yeah, that's a common thing at our house is we'll just sit down quietly in the living room floor and we'll do some stretching. We're not scrolling through social media. I'm not watching the news of what just happened with all the tariffs and all the stock market changes, right? That stuff just makes you feel anxious about the future. It's just quiet, families having some discussion, do some stretching. Even if it's 10 minutes, it makes a difference for me personally. Okay? Any other questions?
Would there be any harm to taking these if you didn't have high blood pressure, or if you didn't know? Because like you said, mine is elevated, but also I remember being pregnant and going to Portneuf, running down from the parking garage, running into that building, going up 3 flights, and then they're like, your blood pressure's high. And I'm like, I just ran a pregnant marathon.
That's such a good example. Thank you. That's a really good question. And I want to answer it by talking about the difference between nutraceuticals and pharmaceuticals. Okay? If we were to name the blood pressure medicines in the pharmaceutical world, they go by names like this. Beta blocker. Okay? The next one is calcium channel blocker. The next one is ACE inhibitor. Okay? And I just went through big classes of medicine. There's another one, alpha adrenergic blocker. Right? Those are big, yeah. ARB, angiotensin receptor blocker. These are the classes. So notice in pharmaceuticals, we're always trying to block something or we're trying to inhibit something. We're trying to block the muscles in here so they don't constrict. We're trying to inhibit something. That's typically not how nutraceuticals work. Nutraceuticals work by giving a gentle nudge, by augmenting, by strengthening. And not in every instance. There are anti-inflammatory nutraceuticals that somehow calm inflammation. But their ability to do that is significantly less than these blockers and these inhibitors. Now, does that mean that these are bad? No. It just means that these are trying to block physiology, something your body was trying to do. It's trying to block that or inhibit that. And nutraceuticals work by augmenting and generally strengthening the body, having a very calming influence. And so your question was, well, if I took a nutraceutical and I didn't have terribly high blood pressure, would it bottom me out? The answer is generally no, it wouldn't. Sometimes they're softer and gentler, and we would need them in much higher doses. But there are some people who sit all day long at 135 over 75, and even though that's not perfect, it probably doesn't merit blocking and inhibiting something. And so a nutraceutical that lowered this to 129 over 71, is there benefit there? I think there is, because we're much closer to that goal. And when you run the marathon from the hospital, 3rd floor out to the parking lot, you come back up and you're running, right? That's a totally different thing. You just need to settle down and your blood pressure will come
I'm
down.
not pregnant, by the way. That was years ago. I just remember.
She's pregnant, we know that.
I remember sitting there.
This is an announcement.
Gender reveal.
I have an 11-year-old.
You see my point to that.
Yeah.
I don't think I've ever had someone who took a nutraceutical and then had a hypotensive episode. Oh my gosh, I took this and I got totally dizzy and fainted and hit my head because it lowered my blood pressure too much. They just don't seem to have that impact. Have I seen that with the pharmaceuticals? Better believe it. It's common. Happens a lot. Right? So we just have to be careful. There's a time and a place for all of them.
Makes sense. Thank you.
Yeah. Any other questions today? Okay. Thank you.
Thank you.
Thank you, Randy.
You're welcome.